Thanks for staying with us right now in our health segment. We'll be discussing diabetes, which today happens to be World Diabetes Day. Joining us right now is the president of the Endocrine and Metabolism Society of Nigeria, Professor Olufemi Basomade. Welcome to the show, sir.
Thank you, ma'am.
Diabetes, we talk about it every year. We kind of celebrate it, but tell us, just for those who are hearing about it for the first time, what is diabetes and how do you get it? Is it hereditary?
Thank you very much for having me. I'm actually the former president of the Endocrine and Metabolism Society of Nigeria. Okay. And diabetes is a non-communicable disease, which means that you don't contract it by contact. And it's quite common in the sense that when you have more and more westernization, diabetes becomes more and more common, just like hypertension. How do you know a person that has diabetes? Usually, most of them are asymptomatic. They don't have any symptoms at all. But for those that will have symptoms, the usual thing that they do notice is they pass plenty of urine, they drink a lot of water because they are thirsty, and they lose a lot of weight over time. Some of them also notice they have blurred vision, and some of them may have tingling sensations in their feet and in their hands. And then some of them discover they have frequent development of boils, maybe in the armpits, around the anus, in different parts of the body. And all of these are things that make people think that this person might have diabetes. Another unusual way they present is a woman that has repeated miscarriages. Sometimes all that is there is just diabetes in pregnancy.
Wow.
Wow.
Scary. We learn every day.
Yes.
New information.
You know, when Mariah asked you the question, I was like, every Nigerian knows diabetes, but, you know, there are some symptoms we know, but you gave even more symptoms. Yeah. But, you know, before we get to diabetes itself, I hear there's pre-diabetes, being pre-diabetic.
Yes.
So is this something that leads immediately to diabetes, or is this something that just warns you and it can be reversed?
Yes, diabetes is just when you have blood sugars that are much higher than normal. But because in the population, you find a wide range of anything you measure. When you look at height, for instance, you see 7-footers, 6-footers, 5-footers. The same thing too, blood pressure and blood sugar. So in diabetes, when the fasting blood sugar is greater than 126 milligrams, you say the person has diabetes. And when it is lower than 100 milligrams, we say the person does not have diabetes. So in between the 100 and the 126 is a gray zone, which we'll say is pre-diabetes. And it gives people who have it an opportunity to prevent developing outright diabetes. And they can do that by just simple lifestyle, losing some weight, doing more exercise. And that is the beauty of pre-diabetes. Yeah, you can reverse it.
Without losing weight, some people have to change their diet.
Yes.
What if I just say, let me lose weight and still maintain the diet of the food I love that can cause diabetes?
Well, if you just lose weight, you'll be taking away one major factor because there are several factors that lead to diabetes.
But there's some slim people that have diabetes.
There are, because there are different types of diabetes. Majority of diabetes, which is a type 2 diabetes, they are usually overweight or obese. For those who have type 1 diabetes, usually they are slim or even underweight.
So the type 1 is the one that can never be cured or something?
Yes, usually a person with type 1 has more severe symptoms. And those ones, they must be on insulin all the days of their life. So it's more difficult to reverse that type of diabetes.
So are there new medications to manage diabetes? Because Nigerians, I mean, we know about diabetes, how you test your blood sugar. In 2023, are there new medications you can use to treat it or even cure it completely?
Yes, when I was training as a student, we had just about 3 different types of medications. But now, for diabetes, there are new ones coming out every year. Right now, there are over 40 different medications. Some of them are readily available, some of them are very, very expensive, and some of them are just injections that you take on a weekly basis, and some of them have profound effects. So there are a lot of new innovations. So if a person has diabetes, ask your doctor, what are the new medications? Is anyone right for me?
So there's this trend I'm seeing quite a bit of with children being diabetic, and not type 1, but type 2. What's happening?
Yes, what is happening with the children who are developing diabetes that are not type 1 is because we are having a transition in the way our children look. Currently, most children, they are much fatter than their parents. So you find a child who is 10 years old is already weighing 70 to 80 kilograms. That type of child is already prone to everything an adult who is overweight is prone to. So you could have a 10-year-old child who has both diabetes and hypertension at that age. So we should watch how we.
So what do you do in a case like that?
Well, part of the reason why it is like that is because with the population dynamics. In the past, people will say if you have 10 children, you have security. So all of them are 10 and they are scrawny. But nowadays, people just have one child.
Yeah, they give all the love.
They give all the love and all the care. They load their lunch pack with drinks and chocolates.
So that means, you know, all those soda drinks should be cut out, especially for obese children.
Yes, they should be.
So how expensive or how affordable is it to manage, especially that type 1 diabetes?
The type 2 diabetes, which usually they're able to manage with just tablets, costs most patients somewhere between 25 to 40,000 naira in terms of tests and drugs on a monthly basis.
But can a lifestyle reverse type 2?
At some stage, yes. For instance, at the stage of pre-diabetes, lifestyle can reverse it. But usually once a person has developed outright diabetes, lifestyle is almost too late. What lifestyle can do in such people is to help them to control the blood sugars and prevent complications. But it's already come, you can't do much about it. For the type 1, they spend sometimes as much as 50 to 60,000 naira per month. And if you have one complication, that cost can go times 3 or times 4 of that. For instance, kidney failure.
Oh, okay, so recently a notable person had to be amputated for part of the body, and they said it was because diabetes was what led to this amputation. Many Nigerians hear that and thinking, I don't want them to cut off any part of my body. So how do we go from being diagnosed to not getting to the point of amputation?
Yes, so again, lifestyle plays a major role. If you have already been diagnosed to have diabetes, there's not much you can do. But the lifestyle can make sure you don't go and have the complications associated with diabetes. Amputation of the legs or extremities, diabetes is the commonest cause of lower extremity amputation.
What leads to that?
So what usually leads to that is, as I said, sometimes patients have tingling sensation in their feet, which the typical Yoruba man will say paja paja or something. They start having cramps and then they can't feel. And when you can't feel, it means you can step on a nail or you can have an injury without knowing. Some people even get burns, putting their foot either on the silencer of a motorbike and they don't know they've been burned.
Oh, God.
So from there, infection sets in again. Because they don't feel pain in that same leg, the infection rages and they delay in going to hospital. And then before you know it, by the time the doctor sees it, it now becomes a race against time, the leg or the life. And very often the doctors have to take the decision, very painful decision, to save the life by removing that leg which is affected.
In dealing with Nigerians, how would you say our attitude is towards diabetes and lifestyle and just accepting it and doing right by, by our lifestyle in handling diabetes and preventing it?
It's quite tough for the average Nigerian to deal with lifestyle. And I'll mention a few reasons. For instance, our roads typically don't even have walkways. So you can't walk easily. If you walk, you might get hit by either a keke, napep, or okada. Our schools don't have playgrounds, which will encourage healthy life.
Don't allow them play.
Yes, children don't play. They are now playing on their phones. And then when you now talk about healthy diet consists of vegetables and fruits. But you find that those fruits are more expensive. It's cheaper to buy a meat pie than to buy a watermelon. So people just go or gravitate to the cheapest things. And fast food is really very cheap. With 400 naira, you can eat a fast food and have a drink and you feel full. Yeah. If you want to go for something with vegetables, one apple is 100, 150 naira.
Yes.
And then before you now start thinking of a healthy meal with lettuce and vegetables, it's quite expensive. So for the Nigerian, it's very tough living a healthy lifestyle.
It's not filling. That's the issue.
It's
expensive too.
But
somebody who's eating a bar.
A full soup is healthy.
Very healthy.
But it's not filling. That's what I'm saying. The bar makes it full. That yes, you're done 1 meal, you're done.
You can eat protein. Protein is filling. You can put your meat and fish and eggs.
And fish and eggs.
Yeah, but somebody would say, because it's the one here, but somebody would say, it's not better for me to use the money and buy proper food and I'll eat it and be full than buy little snacks here and there. But what do you say to schools? Because schools, they have talk shops and all sorts of things. Our children they will not go to school if you don't give them money for that. please, when on a day like this, what is the message to schools?
Well, the message to schools is that they should invest in some healthy choices because sometimes there are a few fruits that are not so expensive. An orange is cheaper than an apple, for instance. And then some schools actually have farmlands. So people they should be encouraged to go and pluck those oranges, those agbalumos and co, rather than soft drinks.
Let me take this call. Good morning, sir. Babatunde, I believe. Oh, I lost that. Go ahead, Waki.
Is it everything with sugar that can cause diabetes?
Yes, what implicates sugar is that it is a highly refined carbohydrate. So it means sugar is not good, fructose is not good, most of the things that are very, very highly refined. So actually it's better to take a big bowl of eba than to take a soft drink which has loads of
rice,
refined sugar. Rice is good, but even rice, there are different types of rice. Our local ofada is better than the Oyinbo rice.
But there's one Oyinbo rice, Indian rice that they sell and they say it prevents diabetes.
Is it the
Yes,
basmati?
Basmati rice. In fact, that's what they use to...
In fact, I think that the hype on basmati is, we don't need it. Yes, it's over-exaggerated. Ofada is better than basmati.
Okay.
Abakaliki rice is better than basmati rice.
Okay.
Eba, fufu is better than wheat that is turned.
I agree.
Eba and fufu is better
Wheat.
than...
What of semo?
Yes, semo is fairly good.
But it's not...
Yes, but not so good. Starch is fairly good also.
See, our
And they are
own
natural.
indigenous foods,
they're
much better for us.
Yes.
So what's the theme for this year for the World Diabetes Day, and what's the message to everybody?
Yes, the theme is access to diabetes care. And when we talk about access, it starts with different levels. First of all, you need to know you have diabetes before you even go and look for care. So access to diabetes care is talking about you knowing you have the condition and knowing where to go to get proper treatment and counsel. A lot of people go to the wrong places, and that's why, for instance, the example of people who have their limbs cut off. Some people may have tingling sensation, and they don't know they have diabetes. They go to the native doctor who uses blade to even cut wounds on that leg and worsening everything.
Let me take this call so we can wrap up. Florence, thanks for calling.
Morning, everybody.
You're live. Go ahead, morning.
Please, doctor, what can you say about people that have family history of diabetes?
Family history of diabetes.
Yes. A very good question, because part of the slogan for this year is know your risk, know your response. If you have a person in your family with diabetes, you are at high risk of diabetes. You are almost pre-diabetic. And if you have both parents having diabetes, it's just a matter of time, except you now take it very, very actively to make sure that I'm going to do all the right things. Otherwise, that person will eventually develop diabetes, even at a younger age than his parents develop them. So if you have a parent with diabetes, check your blood sugar every year, watch your weight, watch what you eat, and try to do a lot of exercise. 30 minutes, a brisk walk every day, and you will prevent diabetes.
You know, I know somebody whose father was diabetic, his sister is diabetic, but he believes that he's not going to be diabetic. He's never been tested, and he always takes a lot of sugar, but he exercises a lot. So he can eat a whole pack of icing sugar or lots of bad food. But his own compensation is that I'm always in the gym, I exercise, I'm okay, I can't have diabetes. Is that true?
Well, some of them are canceling each other. For instance, the sugar is bad, but the exercise, if it is adequate, you can eliminate the effect of that sugar. But not too many people can go to the gym as frequently as you mentioned. So sometimes
And also, as he gets older, too, he may not have the time to do the gym as well.
And I've heard that you cannot outrun a bad diet.
Catches up with you at some point.
So I think that's all we could do. Thank you so much. You covered quite a bit in such a short time.
short.
Thank you.
Yeah, that's all we can take on today's show. Have a great day. We'll see you tomorrow. Bye for now.